The challenges that countries face are actually very, very similar right the way around the world. We have a global shortage of nurses. It's estimated that the world is in the region of 6 million nurses short. There are 28 to not 29 million nurses right the way around the world. Um, that shortage of nurses is occurring at the same time as the demand for healthcare is increasing. Aging populations, more people with non-communicable diseases. So we have this growing gap between supply and demand. And I think from what I know, from what I've read, that's as much an issue in Malaysia as it is in a number of other countries. But that global shortage also means that it's becoming more competitive to hire nurses. So that you see after the pandemic, many countries who went into the pandemic with too few nurses, the impact of the pandemic meant that more nurses left than normally would have done. At the same time, we were trying to respond to the pandemic. Plus, there was a delay in meeting other healthcare needs, all adding to demand. And those countries that were short of nurses, who could afford to, started to look overseas to recruit from other countries. And I know that from Malaysia and from a number of the countries in this region, nurses are attracted to go to other parts of the world. A brain drain, if you like. But that carries real risks to the health of the people of Malaysia because they won't have enough nurses to care for them, to meet their health care needs. And that obviously is very bad for health, but it's also very bad for countries' economies because you need a healthy population to keep the economy moving. And if people get sicker and sicker, actually it's more expensive than treating people when they're first unwell, or even ideally preventing people from becoming unwell. So the big lesson here is for countries to invest more in their nursing workforce, to make sure they've got enough nurses to meet their own needs, that they hold them in the workforce, they don't lose them to migration, and to recognise that when they spend money on nursing home and health, don't see it as just a cost, as a budget line. Think about it as an investment in the prosperity and the wealth of your country, of your economy. This year, for International Nurses Day, which we celebrate on the 12th of May every year, it's the anniversary of Florence Nightingale, we set a theme, the economic power of care, to bring forward the evidence to show people, look, you know nursing for its care and for its compassion, but also look at the evidence and see nursing for its economic power. So pay is obviously a critical factor. Nurses are no different to anybody else. We need to live, we need to eat, we want our families to have, to be able to experience life and to be comfortable. So we should never forget that. And we should also, people talk about nursing being a vocation or a calling, but that's not enough in its own to put food on the table. And when we look at how nurses are paid around the world, we see that they are frequently paid below the average for the economy, for their economy, and that there often isn't the opportunity to progress your career, to be promoted and then to be rewarded for that. And at the same time, we make huge demands on nurses. They give of themselves every day to deliver the best possible care. Physically and emotionally, it's very draining work. They have to work shifts, they have to work weekends. During the pandemic, many nurses stayed at their workplaces for days and days and days to care for people. We need to make sure that we reward nurses with fair and with decent pay, because if we don't, they will make an economic choice, and that's what we see driving migration as well. That nurses who can go and earn significantly more in other countries. So paying nurses fairly is also about making sure that we're keeping patients safe. We do the right thing by nurses, but when we keep nurses in the workforce, when we retain them, and we have sufficient workforce to make sure that patients receive high quality care. There are other things that we can do as well. And there are other countries, if you look at other countries, because pay is fundamental, but career progression, the ability to have flexibility in your working hours. 90% of our profession are women. We have caring responsibilities. To be able to balance home life and work life is hugely, hugely important. Having your voice heard in your workplace. Nurses, I often say that they're a bit like the air traffic control of healthcare. They see when things start to go wrong. They see patients deteriorating. They see where health systems don't work. And health leaders need to be listening to them to ensure safety and quality of healthcare. But often nurses' voices aren't loud enough and aren't heard at some of the top decision-making tables. Not every country in the world has a chief nursing officer. There are hospitals and clinics where there'll be the chief exec, the chief finance officer, a medical director, but perhaps no senior nursing voice. To try and run healthcare without senior nursing leadership, it's a bit like flying blind. So there are in addition to pay, there are all of these issues around working conditions, around leadership, around career and educational opportunities, which together need to be addressed. And the countries that do perhaps most successful in terms of recognising, rewarding, retaining their nursing workforce, it's not about one single silver bullet solution. They do a combination of these things to hold their nurses in the workforce. People always think about nurses, they think about their care, about their compassion. But if you talk to them a little more, they'll often then describe what nurses do as, well, it's just helping people with feeding, with cleaning, with washing. And I think the pandemic has actually been quite important in shifting people's perceptions of the nursing profession. I've seen this in other countries because during the pandemic, yes, we saw the care and compassion, but we all remember we saw nurses in intensive cares, really complicated equipment that they were having to manage to keep people well. Drugs that patients have that nurses administer, some nurses prescribe, much more complicated. Nurses who are responsible for patients' care have to show decision making really in critical moments, in real life and death decisions, and increasingly providing leadership. And just look around the world now at some of the places where there are conflicts and disasters. You see the huge courage of nurses running to disasters when other people turn and face the other way. And I think that the public get the fact that this isn't just about a woman who has a good heart. Yes, it's overwhelmingly about women, but really smart, well-educated women making difficult life and death decisions with technical skills in relation to equipment, to medication, to managing fast-changing patient conditions, and doing it all, not just looking after someone physically, but being very sensitive to somebody's mental health and how they feel as well. Often having to guide people through very complicated health systems as well. Now, when I describe nursing in that way, I say, so should you really be rewarding and paying someone just at the average of your economy? The average of your economy is somebody who, let's say, works in retail. Nothing wrong with working in retail, but compare the demands of working in retail with what I've just described. So why do we have this discrepancy then in what nurses actually do and they're paid? One of the big answers to that is because we're an overwhelmingly female profession, 90%. And that perception, which has resulted in inequality and discrimination because it's seen as low value, low paid women's work. That is changing. Even the World Economic Forum have now got a focus on the care economy, they call it, because they recognise how much value caring brings to economic growth globally. And when you invest in nursing, it will bring dividends to your economy as well as the health of your people. So we have a really big database of evidence, academic evidence, peer-reviewed evidence, written up in medical and health journals that show the very clear relationship between the numbers of patients and the safety of that shows really clearly the relationship between the number of nurses and the safety of patients. When you have too few nurses, the incidence of infections, trips and falls, drug errors, the deteriorating patient not being identified quickly, these things all go up, and so does mortality.